I'm Cathy Troisi. I'm on the faculty at UT School of Public Health. I'm part of the Texas Public Health Training Center and also with TPHA, so I'm wearing a lot of hats up here. And today, now that we've talked about where to get data for your CHA and CHIP and how to facilitate community meetings, we're actually going to talk about what is your community health assessment and improvement plan. So your either state or community health assessment identifies, you go out in your community and actually look for data about what are the issues, what can you work on in your community. And some of the things that, that characterize a community health assessment are that it's a long-term, so you're not looking for quick fixes. That might be part of it, but it's also a long-term strategy. And it's a systematic effort, so you want to engage a lot of people in the process. Some of the things that FAB is going to be looking at, because as you know, a community health assessment is one of the documents you have to have ready before you can even apply for accreditation. So some of the things that FAB is going to be looking at are evidence that you used a comprehensive, broad-based information gathering session, so you got your data from lots of places, not just one source, and that you involved the community. You have to have a demographic description of your community, so you know who's living in your community, what they look like. FAB wants to see a narrative description of health issues and distribution in the community, and they want a discussion of the health challenges and the underlying challenges. So again, looking at a systems approach, not just what's at the tip of the iceberg. A listing of the assets that you can use to address some of these issues. They also want to see that there is a link between your local community plan and the state health plan, because after all, the state is made up of communities, and that the CHA is collaboratively put together, that it's not just, say, the local health department doing it, that you've engaged many players in the public health system. And for accreditation purposes, it has to be within the past 5 years. So once you've assessed your community, you see what the health issues are out there, you need to do something about it, and that is your community health improvement plan, or state health improvement plan, the S. So the purpose of this is to describe how you are going to work with your public health system partners and improve the health of the community, because, as I said, that's our goal. We're action-oriented. So your CHIP should include assessment data about the health of the population, because you want to base your improvement plan on the assessment. It's not just guessing what's a problem in the community. It's actually looking at data. And you need to prioritize what needs to be done, how you're going to do this improvement, what strategies you're going to use, and importantly, performance measures. And one of the things we talked about this morning that is very important are policy changes. If you really want to make a difference in a community, you need to look at up at a higher level at policy changes or structural interventions. You need to know who you need to talk to in the community, who you need to partner with to make these changes, and very important to have outcomes so that you can monitor your progress. Some other things that you need to look at, again, there should be a link between your community health improvement plan and the state health improvement plan. And again, there's that 5-year, it has to be done once every 5 years for accreditation purposes. So now I'm going to have to switch. This wasn't good planning, was it? Physical exercise, right. So I wanted to show you, I know that you heard about lots of places you can get data for your community yesterday. I wanted to show you on the NACCHO website, their toolbox that has a lot of not data sources, but planning documents you can use to help you put your CHA and CHIP together. So since I have to run back and forth, I won't show you those other websites, but go to this and I think you'll find a lot of useful information. I still have to go back.
Cathy, do you want to use this mic?
I could, but you know, that would be too easy. It's all right, Mike, I'm done. So.
You don't have to exercise mine.
Yeah, if only. So we are going to hear from some people today who have been through this process and give you some of their lessons learned about what they found in their communities about doing CHA and CHIPs. And then we're going to break into two groups to do an exercise, but I'll come back and explain that after our speakers. And you have their bios on your flash drive, so I won't spend time introducing them. But our first speaker is Teresa Daub from CDC, who's going to be looking at the national perspective. And I'll put yours up.